Hi, I'm Dr. Greg Simonian. I'm a vascular surgeon at Hackensack University Medical Center in Hackensack, New Jersey. I did my undergraduate training at the University of Richmond and studied biomedical sciences and sociology, and I continued my medical training at the Rutgers University Medical School in New Jersey. My residency and fellowship training was specifically in surgery and in vascular surgery, and then I came to the Hackensack University Medical Center to start the division of endovascular surgery, which is minimally invasive vascular surgery. I've been doing that here for the last 16 years, and I was the chief of endovascular for 14 years, and I'm now the executive vice chairman and chief of operations for the Heart and Vascular Hospital here at Hackensack University Medical Center. We have grown the division to one of the busiest in the state, focusing exclusively on the treatment of vascular diseases. We have a group of 5 doctors in our practice who are all dedicated vascular surgeons. That means their training was specifically in vascular surgery, both open and endovascular, or again, minimally invasive vascular surgery. And it's not the treatment of patients with interventions. We as a group look at the patient holistically. So from their medical therapies, diet, exercise, the regimen of smoking, other things that they have to remove from their lives, along with the things they need to add to their lives. And then when needed, we perform complex, open, and minimally invasive vascular surgery, and all 5 of the partners are dedicated exclusively to this type of practice.
And as far as I'm concerned, there's nobody like Dr. Simonian. He's the cream of the crop.
When I see a patient or our group sees patients, we want to relate to them as people. We want them to feel that they're not just another patient or procedure that we're trying to do. We want them to feel part of our family, and we feel it's very important to us to provide good personalized service in addition to outstanding care.
Patients can expect 5 highly trained vascular surgeons who are very concerned about their patients. And in our practice, the patients come first.
Being a result-oriented physician, to me, means that I am dedicating all my efforts before the surgery, during the surgery, and after the surgery to assure that the patients go through any kind of procedure or operation in the safest way possible and with the excellence and outcomes that I expect, not just from myself, but also from my partners.
My name is Juanita Moriarty, and I was having problems with my veins. My husband convinced me to get my veins done. I explained it to my regular MD, and he recommended Dr. Simonian. I came up to Dr. Simonian, and he did my job. He did the job on my veins, and I am very, very well pleased. Never came back again, and they look great. And I feel much better. I was very self-conscious with my varicose veins, but the crew here was very good, and I would recommend them highly.
One thing I like about work in our group is that we have a team approach to care where we specialize in an individualized approach. With all of us being of different backgrounds and different skill sets, we're able to offer the best medical therapies, minimally invasive treatments, as well as traditional surgery when necessary. And as a collaborative team approach, we're able to give the highest, best technology in the setting of a large research institution by giving the greatest technology available.
Not to take away from the doctors in New York who performed the surgery on my left side, but that surgery was just so much more invasive. This was a piece of cake and turned out so much better. Just great from beginning to end. Service, bedside manner, just wonderful, wonderful.
Outcomes are really being looked at by all kinds of industries, from the federal government to biomedical sciences, hospital financial boards. So outcomes and results are being looked at in a way that they never have. That's not exactly the way that a physician looks at outcomes and results and to be result-oriented. Of course, we want the patient to do well from a procedure, but again, that means mind and body. Doing well and results-oriented also means a responsibility to the healthcare system. The cost of care, the length of stay in the hospital, appropriate use of antibiotics, medications, and materials. So results-oriented aren't simply the patient had a good result from an operation. A contemporary vascular surgeon looks at this in its entirety. And results-oriented, that's what our focus is in our practice, the overall results of care.